critical thinking in the OSCE. In the OSCE, you will be required to show critical thinking when assessing the care needs of your patient. Both the evidence-based knowledge collected in the assessment and your prior nursing knowledge are combined when using critical thinking in practice. You can use past experiences where you gained your nursing knowledge to reflect upon when you assess your patient. Every nurse should have a good basis of evidence-based knowledge about the human body and its disease processes, which aid implementing critical thinking. The practice of nursing requires critical thinking, which is the process of intentional, higher-level thinking to define a client's problem, examine the evidence-based practice in caring for the client, and make choices in the delivery of care. All nurses are directly involved in the decision-making process of the treatment of their patients. It is important that you are able to think critically when assessing patient signs and symptoms and identify potential problems and make the appropriate recommendations and actions. Other health professionals, such as doctors or specialists, are usually in charge of making the final treatment decisions. But nurses should be able to communicate information regarding patient health effectively. Nurses are the most familiar with the individual patient situation as they monitor their signs and symptoms on an ongoing basis and should collaborate with other members of the multidisciplinary team to promote the best patient health outcomes. However, in order for critical thinking to take place, the nurse must not make assumptions or work unquestioningly. In the OSCE, nurses are expected to use critical thinking skills in the following stations. Assessment. Gather information from taking vital signs and finding out about lifestyle habits, using your nursing knowledge base to formulate solutions and referrals. Planning. To devise a plan of care using facts and evidence gained in the assessment using SMART goals and interventions involving the patient. Implementation. Communicate clearly which medications are due and safe to give using the 7 rights of medication administration and correctly documenting. Evaluation. Be able to solve problems and plan for short and long-term SMART goals in the transfer of care letter using the interventions stated in the care plans you have written. Critical thinking is the implementation of data based on facts, evidence, being objective and analytical.